All right. Hi, Rosemary. My name is Sabella. I'm an NP student. I will be doing your assessment today. I'm going to sanitize and wash my stethoscope while I'm doing that. Any concerns or issues you'd like to bring up?
Nope, not today.
Okay. All right. Sounds good. Almost there. Done cleaning. All right, Rosemary. Prior to this, you coming and prior to this assessment, your vital signs were done, and from what I understand, your blood temperature was 98.6. Your heart rate was done with the radial pulse counting for a minute. It came up as 74. Your blood pressure was done on both arms. On the left, it was 110/70, and on the right, it was 112/74. Your oxygen was 98 room air, and your respirations were 16. Is that correct?
Yeah.
All right, and I believe your visual acuity was done as well using the Snellen chart, 20 out of 20 vision, which means you can see 20 feet away. Well, a typical person would be able to see that 20 feet away as well. All right. All right, overall, you look, you do not look malnourished. You look alert and oriented, engaging appropriately. You appear to be the age and sexual orientation as stated previously, in no apparent distress. Any pain or anything that arise? No? Great. Your face is nice and round. It's symmetrical. It's midline. I'm looking at your overall skin. You appear to be the color of your ethnicity. You're nice and warm. Elasticity and turgor is intact. Nice and dry. No excess moisture. I don't see any lesions, scars, nevi. I don't see any nevi at this time. Overall, you look and appear to be very healthy. I'm going to take a look at your head. Looking at your hair, that also appears to be healthy and long, growing evenly. So I'm going to take a look at your in between, your scalp. I don't see any masses, deformities, depressions, any tenderness while I palpate?
No tenderness.
Great. No infestations. I didn't see any masses or bleeding or anything like that. All right. Sorry. Moving on, I'm going to be palpating your pulses here, which seem to be equal bilaterally. Also, if you can clench your jaw for me, your masseter muscle, perfect. We're going to test some cranial nerves, Rosemary. If you can close your eyes for me, and let me know when it feels smooth and when it feels sharp, okay?
Smooth. 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 Smooth.
Great.
Sharp. Sharp.
Sorry.
Sharp. Sharp.
All right. Cranial nerve number 5 is intact. I'm going to ask you to do a couple of things. You can open your eyes. I'm going to have you smile for me. Give me a frown. Puff out your cheeks. Raise your eyebrows. All right. Cranial nerves 5 and 7 are intact. I'm sorry, pucker your lips as well. I believe I couldn't remember if you did that or not. But yes, cranial nerves 5 and 7 are intact. Looks good. I am now going to look at your eyes. Your eyebrows and eyelashes appear to be even and equal bilaterally. I don't see any infestations or any abnormalities there. Your papillary fissures are equal bilaterally. Your sclera is nice and white. No yellowness, no jaundice noted. Your lacrimal duct and your gland, any tenderness?
No.
Rosemary? No discharge noted, no crustaceans, cracks, or anything like that. Your conjunctiva, I'm going to take a look. Nice and pink and moist. It looks good. Whew, sorry. Next, I'm going to grab my pen light, and then we're going to do some assessments of, further assessments of your eye. We're going to start with, confrontation. Rosemary, you let me know when you can see my fingers.
I see.
All right,
I see 'em.
wonderful. Great. Essentially testing your peripheral vision. And cranial nerve number 2 is intact. Next, we're going to look at your pupillary response with direct light and consensual, okay? So you don't have to do much. Just look straight at me. I'm going to shine a little light in your eye. Watch your pupils constrict. Beautiful. And then you're going to look straight ahead. All right, the other one constricts. Great. Other one constricts. Next, we're gonna assess your convergence and your accommodations. All you have to do is follow my pen light here. I'm gonna watch your eyes. All right, one more time. All right, beautiful. Sorry. And then what am I gonna do? Convergence and accommodation, and I'm just gonna look past my shoulder. And then we're gonna test your 6 cardinal gaze. You're just gonna follow my pen light. Watch as it goes up. Just follow with your eyes. Doing great. Looks good. Great. Cranial nerves 3, 4, and 6 are intact. We're gonna test your motility of your eye now, and I'm just gonna use a piece of paper to cover one eye. You just have to look straight ahead at me, okay? I'm gonna cover your eye. Great. Other side. Great. Motility is intact. No deviations. No abnormal movement of that eye. And then finally, we're going to look at some internal structures of your eye. We're going to start with the red light reflex. If you can just stare right at me, and I'm going to move in closer as I see more features, okay? So just hold still right there. Looking at your red light reflex. Then as I go in, we're looking for the retina, macula, the optic disc, and the cup, which all appear to be present. At this time. All right, so it's all appear to be present. No abnormalities so far. You feeling okay?
Yep.
All right. Next, we're going to take a look at your ears, which appear to be even bilateral. I'm sorry, I used the ophthalmoscope to check your eyes. And now I'm going to look at your ears. They look to be even bilaterally. I don't see any deformities, any tenderness when I palpate the pinna and the tragus or anything like that.
Nope.
No pain.
No pain.
All right. No inflammation. No no discharge. No bleeding noted. And no tenderness. We're going to use the otoscope. I'm going to take a look inside your ear. We're going to start with the external ear canal. And as I go in, I will describe what I see. So if you can turn your head that way a little bit, thank you. Just want to pull up and back. All right, Rosemary. Your external ear canal does not appear to be red, inflamed. I don't see any drainage. I don't see any abnormalities. I can see the tympanic membrane, which is pearly white. No inflammation, no exudate noted. Cone of light is at approximately 4 o'clock, and right now at this time I am unable to see the handle of the short malus process. Handle the process of the short malus is unable to be visualized at this time. Okay, I'm gonna put this away, and then we're gonna do a couple more tests. I'm gonna do the whisper test, Rosemary. I'm gonna come behind you. If you can close your left ear or right ear, whatever you prefer, and then just tell me what I whisper, okay?
Soccer.
All right, then we'll do the same thing for the other one.
Sorry, say it again. Soccer.
All right. All right, and that's the whisper test. And now we're gonna go do the Weber test and the Rhine test using the tuning fork. Essentially, for the Weber test, we're gonna use the tuning fork. I'm gonna place it on your forehead, and you let me know where you feel the vibrations.
On both sides.
Both sides, all right? Wonderful, vibrations equal on both sides. No abnormalities noted there. And then do the ray tests. I'm gonna place it right behind your ear on the bony process. Let me know when you can no longer feel the vibration.
I don't feel it.
All right. Can you still hear it?
Yes.
All right. Beautiful. So air conduction is greater than bone conduction. So that's good and normal. So cranial nerve number 8 is intact. sorry. After the ear test, we're gonna move on to the nose. And looking at your nose, it appears to be symmetrical, appropriate for midline, and appropriate for your body. I'm just gonna palpate, Rosemary. Any pain, tenderness?
No.
No? Good. No pain, no tenderness. No discharge noted, no redness, no inflammation, no blood or any drainage at this time. I'm going to take a look inside your nose. I'll make sure everything's okay in there. Tilt your head up a little bit. We'll use the otoscope to look inside. Sorry, those are a little close to you. Sorry. All right, inside looks to be healthy, no redness, no swelling, no inflammation, no excessive drainage. The septum appears to be midline. Sorry, no bogginess, nothing like that. It looks good. With that being said, I'm going to have you close your eyes. I'm going to have you close your eyes, and then I'm going to let me know what you smell, okay? It's under your nose. I'm going to whisk it by. What does that smell like?
Alcohol.
All right, alcohol wipe. Great. Cranial nerve 1 is intact. You can open up your eyes. Looks good. Now that your nose is done, I'm going to sanitize again. We're going to take a look at your mouth and throat. I'm going to use my pen light for this and a tongue depressor. Looking from the outside, your lips are intact. They don't appear to be cracked, bleeding, or any abnormalities noted. Your teeth appear to be intact. You got a great smile. If you can open up for me, open up. All right, inside everything looks to be nice, pink, healthy, and moist. No abnormalities noted. Your salivary glands are intact, no inflammation, doing their job. You put your tongue down, perfect. I'm just gonna press a little bit in the back. Your palate's normal. Your uvula, say ah for me.
Ah.
Uvula is intact, midline, raise it straight up, no diversions. Your tonsils appear to be flat. I'm going to grade them as 0. I don't see them at all. And then one more time, I have you stick your tongue out. All right, no fasciculations noted. Perfect. Cranial nerves 9, 10, and 12 are intact. So let me put this over here. Whew. All right, 9 and 10 are intact. And then from your mouth, I'm going to be testing, looking at your neck. I'm going to be, if you can clench your jaw for me one more time, your TMJ here. Open a couple of times. Open. No crepitus. Open one more time for me. Good. No popping, no crepitus, no any tenderness.
No.
Noted. No. All right. No tenderness, no deformations or anything like that. So that looks good. Overall, your neck looks to be good. Your skin, like mentioned earlier, is nice and warm. It's intact. It's elastic. It's nice and dry. No excessive moisture. There's no lesions, scars. You do have one nevi on the chin. But other than that, no abnormalities noted at this time. It's nice and warm. With that being said, I'm going to palpate your trachea. Just going to touch nice and midline. I'm going to, your thyroid cartilage. And then carotid, corticoid cartilage. Then Rosemary will come behind you and check your thyroid gland. You don't have to do anything. I'm just going to palpate your, you can lift up, palpate your neck. Swallow for me. Good. One more time. If you can muster up anything. All right. Sounds good. No bulging, no nodules, no abnormalities noted. It looks good. At this time, we're going to move forward and I'm going to check your glands. We're going to start with the preauricle right here. No bumps, nodules, lesions. Preauricle, postauricle, occipital back here. Everything looks to be good for now. Sorry, I'm going to bend over. Then we're going to go up to your tonsillary. Nothing there. Submandibular. Looks good. Submantle. And then if you could turn your head to your side for me. And I'll go superior cervical. Everything looks good. no bumps, lumps, or any abnormalities. Your posterior cervical, and then your deep, your deep chain. Um, um, Lymph nodes look good, no abnormalities whatsoever, and your supraclavicular as well. No bumps, lumps, or any abnormalities. Okay, so those look good. Short breath. All right. With that being said, I'm going to have you do a couple of things for me. We're going to assess your range of motion of your neck. So if you can flex your neck for me and extend back. If you can extend a little further back, good. And I'm going to have you side to side, good. And then do a little rotation for me. Perfect. No pain, no tenderness, nothing like that.
No.
Perfect. All right. And then last but not least, I'm going to have you push up against my arms, little shoulder shrug. Perfect. Cranial nerve number 11 is intact. All right. Feel good about that?
I feel good.
All right. So now we're going to move on to assessing your respiratory. Rosemary, if you could just kind of sit at an angle for me a little bit. Thank you. All right, so I'm looking at your respiratory here, posterior and anterior, and you don't seem to be tripoding. You don't seem to be having any trouble breathing. No nasal flaring noted. No accessory use of muscles. Your skin, posterior and anterior, looks good, nice, dry, warm to touch, intact. I don't see any deformities. I don't see any lesions, scars, bruises. It's nice and elastic. Appropriate color for your ethnicity. If you could take a couple of deep breaths for me. Good. One time. All right. Symmetrical chest rise and fall. Any tenderness while I palpate, Rosemary?
No.
No tenderness, no pain.
Mm-mm.
Okay. That's good. I'm gonna touch a couple of sides, and I just want you to say 99 for me.
Okay.
I'm gonna check your firmness here.
99, 99, 99, 99, 99, 99.
All right. Sounds good. It looks good back there. I'm gonna grab my stethoscope. We're gonna listen to your lung sounds. You don't have to do much. Just take a deep breath in. During this whole assessment process, anything I do to one side, I will obviously be doing to the other. But for the sake of time, we're just going to keep it to one side. So I'm just going to listen to your lungs. Just take a deep breath every time you feel my stethoscope. All right. So bronchial lung sounds were heard. Bronchiovesicular and vesicular lung sounds as well down below. Now I will palpate, Rosemary. You don't have to do too much. Just bear with me. I'm going to palpate your lung fields here. All right, Rosemary. Next, we're going to check your diaphragmatic breathing. For this, whenever you can, if you can just exhale as much as you can, and then let me know. Hold it for a second, okay? Whenever you're ready, just exhale. All right, hold it. Okay? You can breathe. Breathe normal. Take a few normal breaths. All right, whenever you're ready, take a deep breath in and hold. Okay, that is measuring about 4 centimeters, which is good. You can breathe. Just breathe normal again. Okay. So normal lung sounds upon initial auscultation, and now we're going to do a couple more auscultating of the lung sounds. Every time you feel my We're gonna check for agophony. Every time you feel my stethoscope, Rosemary, just say E.
Okay.
Okay. Hold on 1 second. Let me just. Whew. So just say E every time you feel it. Okay.
Okay. E, 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 E.
All right. So that was agophony. Now we're gonna check for bronchophony. Every time you hear my stethoscope, please say 99. Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. And then last but not least, it's called the whisper test. And then, I'm sorry, whisper paralleloquy. I'm gonna whisper 1, 2, 3 every time you hear my or feel my stethoscope. Okay.
Okay. So I already said 99, so I'm gonna say.
Hmm?
Sorry, what am I saying now?
Whisper 1, 2, 3.
Oh, whisper.
Okay. All right, that was good. No abnormalities noted. You passed all those little tests. And then you could turn around. We're gonna do very much similar on the front. So looking at your chest anteriorly, as mentioned before, your skin looks and appears to be intact. No abnormalities noted. It's nice and warm to touch. It's elastic. Skin tones are intact. I don't see any nevi. I don't see any scars, lesions, bruises, or anything that's really abnormal. So I'm gonna lay you back just a little bit, or you can lean back just a little bit. There we go. So chest looks good. I am going to palpate your skin or palpate the chest. Any pain, tenderness? Nothing. All right. No pain, tenderness here. Sorry. All right, we're gonna percuss. Good. All right, and then I'm going to also take a listen to your lung fields in the front. You don't have to do anything, just take a breath in every time you feel my stethoscope. And we're going to start up here at the trachea, okay? Good. Good. All right, so bronchial lung sounds were heard up top, bronchiovesicular towards the middle of the chest, and then vesicular lung sounds towards the bottom. So that looks good. No abnormalities noted here. No tripoding, no nasal flaring, no use of accessory muscles, no retractions, no shortness of breath, no cyanosis noted, and no tenderness upon palpation or anything like that, correct?
Yeah.
All right. Sounds good. I'm gonna keep this. Okay. Next, while I have you sitting up, I'm gonna take a look at I'm looking at your your chest. We're gonna assess your heart. I don't see any heaves, any thrills, any pulsations, any pain, shortness of breath, or anything like that.
No.
Fast heart rate or anything.
Nope.
No. All right, so I don't see any of that. I'm gonna palpate around your aortic, pulmonic, tricuspid, sorry, and then Erb's point is kind of here, and then down all the way down here to your mitral valve. Oh my God. I'm gonna stay here for about a minute. For the sake of time, we're gonna say it's been a minute. It appears to be regular, normal, no abnormalities noted. Heart rate's roughly about 72 to 74. Okay. Next, I'm gonna auscultate all those same areas. Right. You don't have to do anything, Rosemary. Aortic, pulmonic, and tricuspid. Erb's point. And your mitral. Alright, which we would obviously listen for a minute. It's mid-clavicular, fifth intercostal space down. And again, it's normal and normal with a roughly 74 to 72 heart rate, okay? And we do that with the bell and the diaphragm. I'm just gonna go back quickly, do it with the bell, and then sorry.
Okay.
Right. And then your mitral. All right, perfect. And like I said, we listen for a minute, note the heart rate and the rhythm. Okay, looks good. All right, now I'm going to have you kind of lay back and we're kind of go through the same process for the heart. So I'm going to recline you back. Thank you. Are you comfortable? You look comfortable. All right, so laying you back, again, we're assessing for any thrills, pulsations, any abnormalities that can be seen while you're laying down, and you don't seem to have any. Everything appears to be as it should and appropriate. Again, I'm going to listen to all the points. I'm going to palpate and listen to all the points with the bell and the diaphragm. We'll start with palpating. Kind of palpating, any pain, tenderness, nothing like that.
Nope.
Good. Good. Down here to my mitral valve. Good. We're going to stay here for a minute and feel, like we mentioned prior, for a minute, but due to sake of time, we're going to pretend that was a minute, about roughly 74 to 72. Normal pulsations noted. And now I'm going to listen and auscultate all the cardiac sounds and with the bell and the diaphragm. So you don't have to do anything, just breathe normal. Aortic, pulmonic, tricuspid, Erb's point, and the mitral. Again, for a full minute, heart rate is 72, 74, normal, no abnormalities heard. And we're going to do the same thing using the bell. Going to listen. Great. And then last but not least, all right, that was about a minute. 72, 74, regular rate, no abnormalities noted in the chest or anything like that, no visual heaves, thrills, or abnormalities. Next, I'm going to take a look at your, for any JVD, I'm going to assess your JVP. So I'm gonna lay that there for a minute. So I'm gonna palpate your arteries. All right, looks good. Rhythm appears to be regular. Nice, strong pulsations. No abnormalities noted. We're going to look at your JVD and assess your JVP. So if you can look to your right, Rosemary, turn your head that way. I'm going to look for any thrills or any excessive pulsations. So I'm going to try to get comfortable. Sorry.
No, you're fine.
Awkward angles.
Are you okay?
Yeah. I don't see any jugular vein distensions. I'm gonna listen for any thrills or bruits. Using the diaphragm. And the bell. None are noted. We're going to check your jugular vein distensions. If you could turn your head that way for me. Perfect. I'm going to locate the pulsation, which is essentially about right. Top of the pulsation. Sorry if I pinch you or poke you. And it appears to be about 4 centimeters. Whew. Which is good, normal, no jugular vein distension, and pressure is also normal range. We auscultated, we palpated. Any complaints? Okay. Whew. Now we're going to be moving on, Rosemary, to further assess your peripheral vascular system. So I'm looking at you right now. I'm looking, I don't see any aortic abnormalities. There's no pulsations, there's no heaves, thrills, or any abnormal bulging going on. Oh. None of that. No abnormalities with that. I'm gonna put this down a little bit. We're gonna palpate just above for the aortic pulse. And then we're gonna palpate for the renal. Again, whatever I do on one side, I would do to the other for the sake of time. Then we'll do the iliac. All right, and then the femoral pulse. All pulses are palpable. No abnormalities noted. Equal bilaterally. No abnormalities noted at this time. And what are we missing? No abnormalities noted, so we palpated, inspected. Next, we're going to move on to your radial pulses. Sure, I feel like I'm missing something. That'll come to me. All right, so I'm missing something. Palpating. Oh my gosh. Palpated the aortic right above. Palpating the aortic. Oh my god, the aortic. So I'm gonna palpate using both hands. I don't technically feel it, but I don't feel any bulging, any pulsations, or any abnormalities. Any tenderness, Rosemary, when I palpate? No. Okay. No tenderness, no pain or anything like that.
No.
Okay. No, I didn't feel any bulging or any inflammation or any pulsation, abnormal type of pulsations. So that's fine. And then we're going to move on to your radial pulse. No, we're going to move on to your abdomen. I think I'm getting myself confused. We're going to move on to your abdomen. And now with the abdomen, we are going to be assessing for, I feel like I'm missing something. Hold on, give me a second. Yeah, no, we're gonna move on to your radial pulses. Let me see your arm, Rosemary. I'm gonna check your brachial radial, no, your radial pulse, which is strong, pulse bounding. Your brachial radial pulse. I don't see any skin abnormalities, colors intact, appropriate to ethnicity, no swelling, no edema. Skin turgor is intact. Capillary refill is intact. All throughout the arm, no edema, no pain, no tenderness, Rosemary, anything like that. Good, strong pulses. Pulse it there, pulse it there. We're gonna check your femoral pulse, which we already did. It was nice and strong. Bilaterally, obviously, but for the sake of time, I'm gonna check for any edema, any tenderness, any swelling, any discoloration, any pain anywhere. I'm gonna check your palpatile pulse behind here. It's nice and strong. No edema, no crepitus found anywhere in any of the extremities thus far. No deformities, any tenderness, pain while I do this. No swelling, no bruising, no lesions noted. We're gonna go all the way down past the calves. We're gonna check the posterior tibial. Pulse is intact. Dorsalis pedis, pulse is intact, nice and strong in both areas. No edema noted, no abnormalities, skin intact, appropriate color to ethnicity. Capillary refill, appropriate, nice and brisk. No swelling, no tenderness, no pain, no shiny shins, hairlessness. Hair appears to be appropriate to the extremity. No shiny skin noted. No varicose veining abnormalities, no ulcers, no lesions, no scars. Nice and warm to touch. Okay. All right. And oh my gosh, like, that's where's the breathing or forgetting. All right. No abnormalities noted there. Hair on the toenails. I mean, not the toenails. Hair on the big toe, and I said capillary refill intact, and nails appear to be appropriate size and shape for Rosemary. So, whew, I think we're good there. Next, we're gonna move on to the abdomen. The abdomen appears to be appropriate in symmetry. No abnormalities noted at this time. It's nice and symmetrical. We're going to be inspecting, auscultating, percussing, palpating. Right now, I am inspecting and I see that the skin is appropriate to ethnicity, nice and warm and dry. Skin turgor intact. No lesions. One nevi, I believe, is on the left side here. And no lesions, scars, or any abnormalities noted at this time. I am going to auscultate for vowel sounds using the diaphragm and the bell. Auscultate. All right. Normal active vowel. The vowel sounds noted. After that, I am going to percuss all 4 quadrants. I'm going to percuss all 4 quadrants. All right, so tympani noted towards the bottom, a little dullness towards the top. We're going to check for the liver. Oh, sorry. We're going to check your liver now. We're going to measure it with the mid-sternal borders. So, okay. Sorry, Rosemary, if you can just lift this up a little bit. Thank you. Okay, so that's approximately 5 centimeters. And now we're going to check the measurement for the liver. on the mid-clavicular side. Just normal breathing. Okay, so approximately 10 centimeters for the liver, which is all in normal range. No abnormalities noted, no inflammation or distension. And now we're going to move on to the spleen. Spleen's a little tougher. We're going to do our best to get under the rib cage and percuss that way. Rosemary, can you take a deep breath for me? Hold it. So approximately, you can breathe again, 11 centimeters. No distension noted, no bulging, no excessive dullness found. I am going to palpate the liver. I'm going to palpate all 4 quadrants. Let me know if you feel any pain or tenderness, Rosemary. Any pain, tenderness? I'm going to check the liver. No pain, no tenderness. Spleen. Any pain, tenderness? No. Good. All right. Okay. No pain, no tenderness on palpation, no firm bumps, lumps, or anything like that. Everything was very soft, non-tender whatsoever. Next, we did that, and I'm going to palpate also the inguinal nodes. Whatever I do one side, I will do to the other. Any pain,
no
tenderness, nothing like that. All right, perfect. No bumps, lumps, or anything noted. Okay. After the bowel assessment, or after the abdominal assessment, we're going to assess your upper extremities, so neuromuscular extremities. So at this time, we will be inspecting, palpating, testing your range of motion and your grip strength, okay, or the strength of your extremities. So we're going to start with your arms. What I do to one side, we will do to the other side. We're going to start by inspecting. I'm going to sit you up a little bit more comfortable.
Yeah.
We're going to start by inspecting sort of the general arm. We're going to eventually inspect the fingers, the wrist, the elbow, the shoulders. We're going to start with looking at your overall skin. It looks great. Skin looks intact. No edema noted at any point. Any tenderness, any pain. No crepitus noted. No abnormal nodes found. No pain, tenderness anywhere. Skin is nice and warm. No edema. No lacerations. No bruising or any abnormalities noted at this time. I'm going to ask you to do a couple of range of motions. If you can flex your fingers for me, I'm going to have you flex your fingers, extend your fingers, hyperextend your fingers. We're going to adduct your fingers, abduct your fingers. We're going to test your thumb for circular motion. Thumb. Oh, I just lost the word. It just left me. And then if you can squeeze my fingers, great. Grip strength is great. It's 5 out of 5. That means it's really good. Whatever I do to one side, I'll do on the other side. But moving up to your wrists, again, no crepitus, no pain, no tenderness noted, no inflammation, none of that. Colors intact, range of motion there. We're gonna test if you can flex your wrist for me. You can extend your wrist upward, flexion, and then extension. Good. And then I'm going to have you, we're going to test your ulnar and radial deviation. Just go to side for me. Perfect. And then do a little circular motion with your wrist for me. Great. Looks good. No pain, no tenderness. And then we're going to move on to your elbows here. I'm going to have you flex your elbow for me. Perfect. I'm going to have you extend your elbow for me. Perfect. Hyperextend your elbow. Perfect. All right, and then you can relax. And then we're going to test your brachial strength. Go ahead, push it up against my arm. Good. And then down against my arm. Good. Next, we're going to be, that was 5 out of 5. So far, all have been 5 out of 5. You have good strength in all joints. Next, we're going to assess your shoulder. I'm gonna have you flex your shoulder up for me. Perfect. I'm gonna have you extend it downward. Sorry. Yep. Hyperextend in the back. Perfect. I'm gonna have you do a little internal rotation, external rotation. Perfect. We're gonna adduct your shoulder upwards. Perfect. Abduct your shoulders across your body. Good. And then I'm gonna have you circumflex your shoulder. Give me nice, good around the world swirls. Good. Any pain, tenderness? No, nothing. Perfect. And then I'm gonna have you push outward with your against my hand. Good. I'm gonna have you pull in. Good. All right. That's 5 out of 5. Strength for your shoulder. It looks to be good. Now we're gonna move on down, down towards the lower portion of your arm, lower portion of your extremities. Before we do that, we're gonna test your nerves. Oh my gosh, remember this. Your nerves. I'm gonna test your sensation. We're using the same technique. You're gonna tell me when you feel sharp, when you feel dull. Close your eyes for me.
Dull, 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 dull. Sharp, 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 sharp.
Okay, great. Dull, sharp. Dull, sharp. Then hold on. I am going to use my pen. If you can close your eyes, Rosemary. Close your eyes. Thank you. Your hands. I'm going to place something in your hand. Can you please tell me what this is?
Pen.
All right. And then while you keep your eyes closed, I'm going to write a letter in your hand, and you let me know what that is.
A G.
G. All right. So those are intact. Cerebellar. Oh my gosh, I'm losing my words. Gravesthesia is intact. And the object, the other one was intact as well. I'm trying to think. There was another one. We did that one. Okay. Well, for the sake of time, I'm gonna keep moving. It'll come to me. Next, we're essentially going to be assessing your lower extremities. Oh my gosh, my mind is spinning. We're going to be testing your lower extremities, just like we tested up here. We're going to inspect, palpate, do some range of motion, and test your strength, okay? So looking at your lower extremities, what I do to one side, I will do on the other. Your skin appears to be intact, no swelling, no edema noted, no abnormalities that I can see, maybe a little bruising here, no scars, lesions, ulcers, or anything like that. We're going to start with your toes. Like I mentioned, no swelling, no edema, no abnormalities noted, skin's intact, capillary refill is intact, nail beds look good and healthy, symmetrical on both sides. Now I'm going to have you flex your toes downward for me, extend them upward. Can you hyperextend them a little more? Then we're going to adduct them, abduct them. All right, looks good. Looks good. Looks good. Oh, why am I blinking? Those look good. And then I will check your dorsalis pedis, and then looks strong, nice and strong, bounding your tibialis pulse. Can be palpable, nice and strong. No abnormalities there. And then if you can push down against my hands, good. Up against my hands, good. Strength is 5 out of 5, which is good, nice and normal. We're going to look at your ankles now. Like I mentioned earlier, no edema, skin looks intact, symmetrical, no discolorations, no bruising, no lesions, no scars, any pain, crepitus, anything like that.
No.
Nope. Same thing with your feet, no pain, no crepitus, nothing.
No.
All right. What else? We are going to palpate it, inspect it, palpate it. We're going to, you're going to flex your, you're going to flex your ankles for me. Flex. Sorry, I'm going to sit this down a little bit. So we're going to flex your ankles downward, upward extension, and then I'm going to have you, move them, in, external and then internal. Perfect. No pain, no tenderness there.
No.
Nothing like that. Good. Then I will have you sit down, and then we are going to again look at your knee as I did earlier. No pain, no deformity, skin intact, nice and symmetrical. Slight bruising there. No crepitus pain, tenderness upon palpation. No. Good. And then I am going to have you, what am I going to have you do? We're going to test your strength in your knees. You're just going to push, flex. There we go. Extend, pull back. Good. 5 out of 10 strength. And then if you can just kind of sit back for me, we're going to look at your hips. I know this is a chair, but yeah, your hips. So we're looking again for any deformities, any edema, swelling, anything like that, any pain.
No.
No crepitus noted. And then I'm going to have you, thank you, and then kind of push in, abduct for me, and then adduct outward. Good. Nice and strong hips. No 5 out of 5. No abnormalities noted in any lower extremities, no crepitus, deformities, everything's symmetrical, everything's working as appropriately at this time. And then I did forget to do the Babinski sign, which is essentially, sorry, sorry, I didn't mean to tickle. I'm just going to scrape up against your foot, okay? All right. Okay. Nope. You're good. So that came back normal. Sorry, I should have said something before you jumped. All right, and then the lower extremities, I feel like are done. And then now I'm going to have you stand up, Rosemary. Oh. I know I'm missing something. We did that. We did that. And the tuning fork, medial malleus. We're gonna do that with the tuning fork. So let me know if you feel the sensation, Rosemary.
Yes.
Okay, great. And then this, and then I'm gonna check. I'm gonna check. Oh my gosh, that's what I forgot. I'm gonna check your brachioradial tendon reflexes. So if I can have your arm, I'm gonna check your brachial radialis. Just all right, 2, which is appropriate. I'm gonna check your brachial here. All right, and then we're gonna check your. If you could turn your arm this way. Yep. I'm gonna check your tricep. All right, so far all appear to be 2+, which is normal. We're gonna check your patellar. You can, thank you. All right, there we go. Good job. Again, we're gonna check your patellar's intact and 2+, and then we're gonna check your Achilles tendon here. All right, good. 2+. We checked the radial, bicep, tricep, popliteal, this one, and then we did the Babinski sign. I'm not going to do it again because you're ticklish, and that's fine. So we did that. And now I'm going to have you stand up, Rosemary. I need a little water, sorry. I'm going to have you stand up. I'm looking, visually assessing your spine and looking at your general back. I don't see any deformities. I don't see normal curvature. I see a normal curvature of the spine. I'm going to palpate, Rosemary. Let me know if you have any tenderness.
Nope.
No tenderness noted. Bony spinous processes seem to be intact and intact without any deformities, bulging, or anything like that. Overall back looks to be symmetrical. No deformities. Appropriate curvature of the spine. I'm going to have you bend over, Rosemary. I'm going to check for any scoliosis or any abnormal curvatures, which seems to be straight down. Perfect. No abnormalities noted there. Oh, and then I'm going to have you flex forward for me. Perfect. I'm going to have you come back, backwards, extension. Perfect. And then I'm going to have you rotate your spine as well, side to side. Good. No abnormalities noted there. And then I will also be looking for any kyphosis, any lordosis, which I don't see any abnormalities of the curvature of the spine from the side or the back. There's no kyphosis or lordosis, and there's no Darwig's curvature either. Okay, so those look good. We're going to do some neuro assessments. I'm going to have you stand straight like that. Yep. Close your eyes. Arms straight right in front of you. Supine, I'm sorry. Arms supine. Stand for like that for a minute. Great. You're going to put your arms down by your side. Keep your eyes closed. So no failing of the arms, no downward drifts. Standing like this, there's no side motions or any movement. You can open your eyes, Rosemary. No abnormalities noted here. I'm going to have you walk heel to toe, heel to toe, heel to toe. Good. And you can come back. And then last but not least, I'm going to have you jump on 2 feet, 1 foot, whatever you're comfortable with. Just don't fall. Don't hurt yourself. And then no abnormalities there. You're able to perform all the functions. Any pain, any concerns? No. All right. So that would essentially conclude our assessment. I am going to sanitize my hand to close it off, and that's all we got.